Health Monday with Jared and Jacob this morning from Marble City Pharmacy. Gentlemen, good morning to you.
Good morning.
Good morning.
I see your hair didn't get blown coming in this morning.
My hair is in fantastic shape.
Mine got grayer on the way.
I got you. Well, good morning to both of you. And Marble City Pharmacy will be open today as normal.
Yes.
And so if you got a prescription or refill, or over-the-counter medication, or just questions for these two pharmaceutical gurus, just get by there and talk with them this morning. Medicare Part D. What is this?
Medicare Part D. Well, Medicare Part D are drug plans for people who are on Medicare. Anybody who is on Medicare qualifies for a Medicare drug plan, but that Medicare Part D is just a fancy way of saying that, that's all.
You know, Medicare is for whom, Jacob?
In general, the easy answer that doesn't cover everything is 65 and older. But there are exceptions made for people with certain physical and mental disabilities that people under 65 can get on Medicare. So if you're over 65, you automatically qualify. If you're under 65 with certain disabilities, you can become on Medicare.
All right. What medicines are covered by Part D?
Well, that's a good question. There's kind of two ways to look at that question. First of all, nearly all medications fall under Medicare Part D. There are a few medicines that are paid for by Medicare Part B. Medicare Part B is what you use when you go to the doctor's office. It covers your lab tests and all kinds of supplies. But Medicare Part B also covers certain medications like those that go in a nebulizer, so inhalation type solutions. 99% though are covered by Medicare Part D. The tricky thing though is that each and every plan under Medicare Part D has their own formulary. A formulary is just a fancy word for a list of covered drugs and the tier that they fall in. In other words, how much they're going to cost you. So not every plan covers every drug, and that's part of the tricky part.
Well, how do we select a plan?
You know, when our government gets involved in something, it doesn't get more simple. It gets much more complex. And so, you know, by virtue of living in this county or this area, you have at your fingertips no less than 10 to 15 plans to choose from, and they all cover different drugs at different tiers, and there's very, very much variation between them. So how you find out is, you know, you contact the plans or you contact Medicare directly, or if you really want to do it right, you contact us. And we look at the list of the drugs that plan will cover for the coming year compared to the list of drugs you take, and we find the plan that matches up best for what you need.
Normally, when you mention donut hole, you think of donuts, but this is a type of donut hole. What is this?
It's the time of the morning to be thinking about donuts, isn't it?
Yeah. You didn't bring any, of course.
Not to be thinking about donuts?
The most notorious language related to Medicare Part D is most definitely the donut hole. That's kind of a slang term for what's called the Medicare Part D coverage gap. You guys who are on Medicare Part D plans who take expensive medicines already know what we're talking about here. But the coverage gap is a time of year where, for lack of a better way to say it, the plan starts paying less and less. And this year in 2017, the donut hole or coverage gap starts when you plus the plan have spent $3,900 and what? $750?
$3,700.
That's it. $3,700. Well, I keep Jabber.
Okay.
$3,700 on medication. After that time, you pay 40% for brand name of the total cost and about 50% for generic for total cost. But that can get very expensive if you have a $300, $400, $500 medication. And so you go from a time of the year where you're paying what is a pretty reasonable copay, maybe to your medicine costing $150 to $200 a month. And so the donut hole is kind of a dirty word, and it's a bad time of year.
You mentioned all the plans that are available today, and do all these plans have the donut hole?
Unfortunately, yes. That comes from the wisdom of the federal government, which overrides all of these plans that work under the federal government. So yes, every plan is eligible for a donut hole. Some plans offer higher coverage through the donut hole, but that will come at a higher monthly cost to be on that plan. They're going to get it one way or the other, so it can be bad either way. You know, there are lots of costs in Medicare Part D. You have a monthly premium you pay for the privilege of having the plan. You pay your deductible. It has one at the first of the year. Before the plan pays anything, you're going to pay the first $300 or so dollars.
You're so encouraging.
It's our federal government.
It doesn't sound that good, does it?
Then, of course, you have co-pays as you go. And then you hit the coverage gap if you take a lot of stuff. And you pay a lot of that. So there's a lot of costs involved in this. But every plan, to some extent, yes, to answer your original question, has some form of coverage gap that you can't get around.
We in America, we want it, and we want it now. We don't want to wait till tomorrow. We want it today. But this open enrollment a little bit different, isn't it?
Yeah, each of these plans goes by the calendar year. So in other words, if you have a deductible period, then an initial coverage period, and then a coverage gap and catastrophic coverage on every single plan, they all start over on January the 1st. Mm-hmm. It doesn't matter if you turn 65 tomorrow and enroll for the last 3 months of the year, still going to start over for you on January the 1st. So the open enrollment period for 2018 is October the 15th to December the 7th. Right now, we don't have the plan data for next year. So right now, we could do all the research we want to do. The information is not there to select a plan for 2018. That'll be out in the first few weeks of October. If you're a person who happens to turn 65 or otherwise become eligible for Medicare in the next 3 months, then we're going to need to help you find a plan that will carry you to the end of the year. The catch there is that there's a great chance that the plan you would get for the next 3 months will not be the plan you'll need for 2018. So we'll have to
because they change every year.
Because they change every year.
Can we start all over?
Had to go back to the drawing board. That's right. That's right.
What if you don't take medication? You still need one of these plans?
Unfortunately, yes, for two reasons. Two major reasons. One, let's say I'm turning 65 or I am 65, I'm Medicare eligible, I don't take anything. Well, one, I don't know that at some point halfway through the year I'm not going to have a major health event and go from taking 0 things to taking 10 things every month that are highly expensive. And I need to be ready for that because they can be cost prohibitive. Second, our government... Boy, I'm going to get audited. You know this now, right? I'm going to get audited.
He's going to get audited. Jacob Johnson, ladies and gentlemen.
Yeah, I'm going to get audited after today. Our government has decided they need everybody paying into this system. And so if you choose not to have a plan and decide 3 years from now, I've gotten sicker, I need one, you will now, from that point forward, pay more for your plan than other people will because you're penalized for not carrying one during that interim period. So you'll pay more later.
Jared, honestly, people 65 and up sound a little bit confusing.
This entire thing is extremely confusing, and we encourage our patients and people who are not our patients. Honestly, we give advice to lots of people every year who don't even use our pharmacy. Of course, we hope that they'll start using our pharmacy.
If they use it one time, they'll come back time.
There you go.
That's right. That's right. It's extremely confusing, though. We encourage you to talk to your pharmacist. Come talk to us if you can't get any good help from them. Let us help you sort through the confusion. It's very difficult for you to get it right if you go at it alone. It really is.
Jacob, we've talked about a number of questions. What would be the number one question that's asked about this, you think?
Honestly, the two most common questions we get, one, the very general, I have no idea what I'm doing. What plan should I be on? It's a great question. That's a good place to start. And second, an assumption that we had to be very careful about. We've mentioned that these plans change their list of covered drugs and their list of preferred drugs and lower copays every year. Well, I've had this same plan for 3 years now. I should just stay where I am, right? Not necessarily. They may have dropped all the drugs you're on for next year when the data comes out. So the two most common questions are, which plan should I be on, and shouldn't I just stay where I am? It's been pretty good. Those are two assumptions we can't let happen.
So open enrollment is in October?
October 15th, first day. You got to do it by December the 7th to take effect on January the 1st.
So what would be your recommendation to people now as they prepare for this open enrollment?
Yeah, there's no reason to get in a huge rush. The first or second week of October is when the information will be available. Do your own research. Come up with whatever you think is a good idea. Let us take a look at it. You know, we have, like I said, until December the 7th, so anytime in November, probably a good time for us to knock this out.
And Jared, there's a lot of people in our area that meet the criteria, 65 years old and older.
I don't know what your viewership is. I know that our demographic that walks in our store, it's a significant majority.
I know I'm of that demographic.
I haven't noticed. I wasn't going to suggest that.
No. Not at all.
Yeah.
You'd never be able to tell, ladies and gentlemen.
Right.
But if people just want to come by the store and get more information on this, as you have it, and then come October, you can choose a plan. And if maybe you're watching this morning and you're not totally clear on things, and you want your son or daughter or another next of kin to come in and sit down with you on it.
Do it very often.
Work with a lot of kids, yeah.
And when we say, when you end up having to pick a plan and sign up, when the easiest way to do it a lot of times is online, it's tough to look at, Miss 95-year-old and say, well, the easiest way to sign up is to go to, Medicare.gov and handle all this. Right. So yes, if you would like to bring a family member with you, that is a good idea.
Okay. Thanks, guys, for being with us this morning.
All right. Thank you.
And don't let the wind blow your hair on your way back to work.
For good show.
Aerodynamic.
Jared and Jacob, our guests this morning from Marble City Pharmacy. Every second Monday of the month, we have them in. And Help Monday from Marble City Pharmacy. Go by the store. They got a beautiful gift selection and all that kind of good stuff, too. Gentlemen, thanks for being with us this morning.
Yes, sir. Thank you.
More daybreak just ahead. Don't go too far away.